East Coast. Thank you for joining this webinar, Licensing Laws, a Strong Tool for Healthy Food, being co-sponsored by the National Policy and Legal Analysis Network to Prevent Childhood Obesity, a program of public health law and policy, and the Community Food Security Coalition. By way of introduction, NPLAN is funded by the Robert Wood Johnson Foundation to provide legal and technical assistance to communities that want to use policy tools to create healthier environments. And we get to develop model policies and work with advocates and folks like you to understand how these policies might work in your communities. And I'm particularly excited to present to you today a model healthy food retail licensing ordinance and have a chance to discuss the ins and outs of the policies today. My name is Hannah Burton-Lorison, and I have been with public health law and policy for 6 years now, and in that time have been a co-convener of the Healthy Corner Stores Network, which is a fantastic resource for those of you who aren't familiar with it. It's co-convened by the Community Food Security Coalition, Public Health Law and Policy, the Food Trust, and Urbane Development. And for those of you who are particularly interested in working with the small stores in your community, I strongly encourage you to sign up for the listserv and website newsletter at our website, which is healthycornerstores.org. So on today's call, we are going to be discussing the new Healthy Food Retail Licensing Ordinance, which was developed by one of Public Health Law and Policy's attorneys, Ian McLaughlin, whom you'll be hearing from in just a minute. The agenda for the day will have a brief discussion of the barriers to healthy food retail, which I expect most of you who are on this call are really familiar with this and may be working with this in your everyday life. Then Ian will give an introduction to business licensing in general, and then specifically how he's applied that to creating healthy food retail environments. And then we're so honored to be joined by three amazing community advocates, Alia Ali from Minneapolis, Minnesota, and Jesse Hersher-Gauk and Mike Ball from Buffalo, New York, who will share some of their thinking and practices around healthy food retail, and hopefully that will give you some insights into how this might work in your community. So let's move to a question to warm up the chat box. I'd like to hear from you what your food retail environment looks like. Do you have many small stores, or do you have very few retailers at all? If you can enter a brief description of your food retail environment in the chat box, which will appear on the lower left-hand side of your screen. We'd welcome hearing that. And while you're typing your responses, I wanted to share a little bit of a perspective on the food retail environment. I follow the latest research and news on the food retail environment quite closely, and there have been a few studies in the news recently saying that grocery stores aren't the solution to childhood obesity, which I think we know that intuitively. But what that picture doesn't tell is what the whole food retail environment looks like. And it is true that even in low-income communities, there may be sources of healthy food, whether we're talking about supermarkets or produce stores or farmers markets. But we also see a really high saturation of convenience stores. And that's really, that imbalance is part of what we're talking about today. And I'm seeing your comments come in describing exactly that you have many different kinds of options, but not enough healthy choices in your community. So this tool that we're going to present today is really about lifting up the baseline, increasing the baseline availability of healthy food, and providing some incentives for even those small stores to go further beyond. And this licensing ordinance may be particularly beneficial for small stores, but could absolutely be adapted to supermarkets. And Ian will give lots of examples about what that might look like. I wanted to, of course, I'm sure you all can guess what that big slice of the pie, remaining slice of the pie might be. That refers to fast food restaurants. And we know that people are eating out more and more. It's probably true of all of us on the call as well. We're not going to focus on restaurant licensing at this point in time, but I did want to highlight that for those of you who are in communities with a saturation of fast food or other restaurants, NPLAN has developed a really great tool, a Healthy Restaurant Certification Program, which you can download from our website and join us on a future webinar to learn more about that. So a bunch of you have actually already responded to this question. I hear someone from Milwaukee saying that even the stores that are there are very low quality nutrition environments, that you do see some healthy options, but not enough. So that's exactly what this tool is designed to address. Now, many of you, we know, are actively already working with small stores in your communities. And I think it's really important to emphasize that the policy that we're presenting today is very, very complementary, to programmatic efforts to work with small stores. We've seen over the years lots of really great work to improve the produce quality in small stores, different strategies for limiting the junk food availability and shifting it to more to healthier snacks. We also see really great strategies around the country getting really healthy grab-and-go options into stores. There's a lot of work underway to decrease advertising for unhealthy choices, whether we're talking about tobacco or alcohol or unhealthy foods, and really make it easy for people coming into the store to replace that unhealthy advertising with shelf talkers and posters and other in-store marketing materials to help the shoppers identify the healthy choices. But the challenge, I think, that all of us are facing is these types of interventions are really difficult to sustain over time. They can be they can require really significant investments of time and people power, and are really expensive when you're working so intensively with one or a small handful of store owners. So the question that we asked ourselves is, what if you could adopt a policy at the local level that required all store owners to carry a certain minimum selection of healthy products like whole grains, low-fat dairy, and produce? Just if you wanted to open a grocery store and do business in a community as part of being a good neighbor, what if you had to meet a certain minimum? What if food retailers were required to submit applications to become SNAP certified, or if appropriate, to become WIC authorized retailers? How would that change the food retail environment? And I've seen lots of studies and spoken to you on the call, and we know that it's uneven. In some communities, many or all stores are already set up to accept WIC, and there may be an appropriate number of WIC stores in your community. But for some communities, these basic federal nutrition assistance programs aren't available. What if that was evenly distributed according to need? So I'm going to be joined now by my colleague Ian McLaughlin, who's going to describe a tool to do exactly that. He's going to explain how business licenses work and how they can support the work that you're already doing in your community to create healthy food retail. Ian is a fantastic colleague to work with here at Public Health Law and Policy because he works both on tobacco control and childhood obesity issues, all of which really come together in grocery stores and corner stores. And he has a really interesting background for this work. He's been a municipal attorney and a city attorney in private practice, and he brings a really creative perspective to this work. So I'm going to pass the ball over to Ian to get us started by explaining what business licensing is, and then to go into some detail about how that works with this new ordinance. Ian?
Thank you, Hannah. That's a wonderful introduction to what we're going to be talking about here today. And As Hannah noted, I'm going to be talking about business licensing as a strategy to create healthy retail environments, but also to complement a lot of the programmatic work that's going on around the country. We surveyed a number of colleagues around the country on their programmatic work when we were developing this ordinance, and tried to keep that in mind as we were developing a policy solution to really complement that. As Hannah noted, I have done a lot of work in tobacco control as well, including a lot of work on tobacco retailer licensing. And those of you on the call who also work in tobacco control and have worked with tobacco retailer licensing will find some of what we're talking about to be very familiar, because really I imported a lot of what we're doing with tobacco retailer licensing into this new policy that we've developed. But regardless of whether you have worked with tobacco retailer licensing before or any business licensing before, everybody is familiar with the concept of licensing in your own personal life. Most people on the call probably hold numerous personal licenses, and probably the most common among those is a driver's license. We all know that in order to operate an automobile, you need to have a driver's license issued by the state where you live. But really, the driver's license is more than just the little card that you get. It really represents a series of policy decisions that are put into place through the licensing scheme as a regulatory system. So you can only get a driver's license if you're over a certain age, usually 16. A lot of states are now going to provisional licensing, where even when you get your first license, you have restrictions on when you can operate a car and who can be in the car with you until you're age 18 or even more. In order to obtain your license, you have to pass a written exam, a driving exam, in some places like California, an eye exam as well. And then very importantly, that license is not a right to drive forever. It can be suspended or even permanently revoked if you violate driving laws or other laws related to the roadway. So really, there's a lot of different policy decisions that are wrapped up into your driver's license. And I think whether everybody thinks about their driver's license like that or not, it's a really important way to look at licensing. The license itself is really just a way to carry out all of these different policy decisions. There could have been other ways to do it. It could have just been a direct law, or maybe some other form of law that could have done all these, imposed all of these restrictions. But licensing was really the way to tie them all together from beginning to end, and has proven to be so efficient and effective at doing so that every state has used driver's licenses. And driver's licenses are not the only license that everybody uses in their life. As an attorney, I also have a license to practice law, which required many painstaking years of law school and much expense. But at the end of it all, I now am the proud owner of a license to practice law. Many professions also require their own license, like medical doctors and others. And aside from vocational licenses and professional licenses, you often need a license from your region or your state in order to engage in other activities, such as I have a license to fish. And in many places, you also need a license to own a pet. So likely everybody in the call has one or probably many different personal licenses in order to drive or to do other things in their life. And if you think about what it took to get those personal licenses and what it means if you violate some of the conditions that are attached to those licenses, that's really the concept that we're talking about when we move from personal licenses into business licenses. Business licensing is also very common. In fact, probably in almost every city and county across the United States, businesses need some form of license from the city or county in order to operate. Usually it's just sort of a basic requirement, and the license often does not carry any additional requirements. You have to pay a small fee if you're the business. You have to provide some basic rudimentary information to the local government in order to obtain your license, like your business name, your business operating address, and a tax ID number, something like that. So that's really a very common function of the police power, that is requiring a business license just in order to keep track, essentially, of the businesses operating in your jurisdiction. But business licensing can really do even more than that, and you see some of the different things that can be done through business licensing listed on the left here. Business licenses can regulate who can engage in a certain business, who can sell certain products or engage in certain service businesses, and where they can do so within the community. Also importantly for our discussion here today, The business license can also impose different conditions that must be met in order to keep your license in good standing. If you think back to the driver's license example, the conditions are that you cannot be convicted of driving under the influence of alcohol, for example. That's a condition of the driver's license. And similarly, you can impose conditions on a business license as well. And then equally important is what's going to happen if those conditions are violated. How will the conditions be enforced through the license? So if you think about this list of different requirements that can be imposed, you can also think about specific businesses that commonly require licenses across the United States. And here are some photos of different kinds of sales and service businesses that typically need a specific license from a city or county or even a state in order to operate. Sales of alcohol and tobacco and firearms, for example, often require a special license, as do massage parlors and restaurants. And the reason why these require special licenses is because the city or the county has determined that there are specific standards of operation that are required for these kinds of businesses in order for them to operate in a way that protects the public health and safety. For example, tobacco cannot be sold to minors, and it's very important not to sell tobacco to minors because most adult smokers start when they're youth. So making sure that retailers are responsible about not selling tobacco to minors is a very important aspect of protecting the public health for local governments, and licensing is a very effective way to do that. Likewise with restaurants, it's very important that restaurants adopt and engage in very food handling procedures that are safe, and refrigeration techniques and service and preparation techniques for food. And those conditions can also be not only imposed through a license, but inspected through the license as well. And so it's very common that restaurants require a license to operate as well. Now, most of the examples you see on the screen here are businesses that might provide some harm to the public health or provide services that might foster some activities that harm the public health. But we wanted to look at those concepts of licensing that are useful in these kinds of contexts and look at them in a more positive light. And we really distilled several aspects of a license program that can really be imported into the healthy retail environment context. For example, licensing is an extremely effective way to create change. Licenses typically have to be renewed periodically, almost every year in most cases, and it's a very effective way to engage retailers and to provide outreach. The retailers have to apply for the license. They have to be issued the license by the government. That's a natural way to engage retailers and to provide oversight. When the license comes up for renewal, it's a nice chance for the government to look over the past year and see if there's been any violations of the conditions and that sort of thing. So licensing is a very effective way and a very efficient way to create change because it really is a natural way to reach out to retailers. Also, licensing provides for local control over conditions of operation. For any area that's not preempted by a state or a federal law, the local license can impose conditions of operation that make sense for your community. And as I'll get into in a second, we have some model requirements and incentives and conditions in our model policy, but it's really going to be different for every community. So that local control is very important. That is, you can decide what kinds of conditions are appropriate for your jurisdiction. And finally, licensing and zoning have a lot of overlap to them, and I think many people are very familiar with zoning, probably more so than licensing. And many of the things that you can do with zoning can also be done with licensing and vice versa. But I think that licensing provides a benefit over zoning because it typically can apply to new and existing businesses. A land use law like zoning typically applies to the land, and it's very difficult to change land use requirements for existing businesses. Typically, a new land use law will only apply to future businesses. But a licensing program, a license is typically seen by the law to be personal and not a property right, and so it can apply to existing businesses as well. So using those three sort of tenets of licensing, we have developed a model licensing ordinance for healthy food retailers, and it really is a step back to look holistically at the retail environment beyond just tobacco to look at healthy food, to look at other requirements and conditions that might be necessary in order to create a comprehensive healthy food retail environment. This document is still under review by the Centers for Disease Control, which provided the funding for this project, and it's not yet ready to be published, but it is available to persons who are interested. We're going to ask a question on the evaluation to determine your interest in this policy and receiving technical assistance from us at PHLP Audit, and we are available to provide that TA and provide the model ordinance as well to interested parties. But let me go over some of the things that are in the model ordinance and some of the key conditions and some of the key policy choices that we have decided upon in creating this model. And again, it was created with feedback from all across the country, all of the programs that are working on healthy food retail environments from across the country. So we tried to incorporate as many of those concepts as we possibly could. So the first real big policy choice is, what is your license going to require? And what can a license require? And basically, I'll go over the specific requirements in our model ordinance in a couple of slides, but a license can really require many of the things that healthy food advocates have been working on already, such as making sure that our food retail outlets sell fresh produce and staple foods, making sure that they participate in federal nutrition assistance programs, and other things that are necessary in order to increase the healthy food offerings in your community. But in addition to the baseline requirements of the license can do other things. The license can also provide incentives for retailers that exceed the minimum requirements and meet enhanced performance standards. Again, I'll talk about that in a couple of slides. But the incentives piece is really an important piece because it's really where we tried to incorporate a lot of the programmatic aspects of healthy food retail work into a jurisdiction-wide policy. In addition, licenses can also restrict certain behavior, and a license is really an effective way to make sure that your retailers are complying with all applicable laws, whether they're state laws or federal laws that apply in the retail environment. So really, the license can be used to require certain things, to provide incentives, to restrict, and to enforce. And here's where we decided to create some baselines in our model healthy food retailer licensing ordinance. So in the model ordinance, there are some baseline requirements, and that is all retailers who are subject to the ordinance have to comply with these minimum requirements in order to keep their license in good standing. These requirements that you put in this section would be mandatory for all license holders, all food retailers that are required to get a license. And probably the top two there, and the most important reason for enacting or adopting this kind of ordinance, is to increase the availability of staple foods like dairy products, proteins, and whole grains, and produce. So in the model ordinance, we have minimum standards for carrying fresh produce and also a certain amount of frozen produce, a certain amount of frozen produce that can fulfill this requirement as well, and also a certain minimum amount of staple foods. There are a number of different ways to measure the amount of staple foods or produce, and I just want to note that the one that we chose in the model ordinance is a percentage of selling area or shelf space devoted, thinking that this is probably the most efficient way for inspectors to go in and see if there's been compliance or if there needs to be more stocked or something like that. But this is not the only way to measure the amount of staple foods and produce. There are a lot of programs that are measuring requiring certain specific numbers of varieties or certain specific foods, and you could do that through licensing as well. So this is really a requirement that needs to be tailored to meet your conditions. The other thing that, the other aspect to this as a policy decision is what percentage of selling space do you want to require for staple foods and produce? And we actually have those left blank for reasons I'll describe in a moment, but that really is a decision for your community as well. How much do you want to require? In addition to just baseline requirements for stocking staple foods and produce, you can require other things, such as participation in federal nutrition assistance programs. Again, in our model, we have mandatory participation in SNAP and WIC, and that might be different. There's many communities that might not want to require all retailers to participate in WIC. So you could really modify these requirements to fit your own needs. In addition to the mandatory requirements as well, I also noted that licensing can be used to restrict and you can restrict sales of unhealthy foods through the license as well. So part of a healthy food retail environment is not only requiring the healthy stuff, but you could limit sales of sugar-sweetened beverages, for example, to no more than a certain percentage of overall beverages sold. And then finally, in our model ordinance, we have many provisions that require, as a condition of the local license, that retailers comply with existing laws related to tobacco and alcohol sales and signage as well. This is really to promote healthier food retail environments as well. And in many places across the United States, local laws on things like alcohol sales may be preempted. But that doesn't mean that you couldn't condition a license on just compliance with existing laws. So these 5 bullet points here are really the crux of the requirements that we put in the model ordinance for healthy food retailers. But really these could be modified to do whatever you'd like, whatever makes sense for your community. Because whatever it is that you don't want to require and make mandatory, I'll move on, you could put in as an enhanced performance standard. That is, for things that you don't want to make mandatory but you still want retailers to do, you could say, well, this will be the enhanced performance standards. We have a section devoted to this. Listed here are some of the things that we have in the enhanced performance standards section. These are not mandatory for retailers, but retailers that meet these criteria will be entitled to an incentive. And I'll move on to the next slide, which lists many of the incentives that we have in the model ordinance. Most of you on the call are probably familiar with some or all of these, such as expedited processing of licenses or permits, reduced or waived fees, technical assistance, grants or loans, and so forth. So the enhanced performance standards and incentives piece are really the part of the ordinance that is designed to incorporate your existing programmatic work into a policy. Some things you want to make mandatory, and it's important to decide what makes sense for your community to make mandatory for retailers. But in addition to that, you can provide incentives funded by whatever source you have funding for retailers to meet enhanced performance standards. So the sources of funding for these incentives might be any existing programmatic funds you have, grants, things like that, maybe even some of the healthy food finance initiatives that we're seeing across the nation as well. So these might change over time, and you would want to give yourself the flexibility to change these incentives over time as well. So really, in terms of the actual retail environment, what you're going to require and what you're going to incentivize are really the two main decisions to make. And again, we have some defaults in our model ordinance, and those can be tailored to meet the needs of your community. The next really important policy decision is who's going to have to get a license. Here you see sort of two ends of the spectrum of food retail outlets, the small corner store, all the way up into the 50,000 foot plus giant Safeway stores like we have in some of the suburbs out here in California. Really, this is a decision that you can make based on the needs of your community. The one note I want to make from a legal standpoint is that the law requires that similarly situated businesses be treated equally under the law unless you have a good reason to treat them differently. And the reason doesn't have to be so legally compelling that you have to work it up over years and years, but you have to articulate a reason if you want to only, for example, require a license of corner stores and not grocery stores. That reason could be, well, corner stores are really the problem and we have data to back it up. But it's important that if you want to only apply your license to certain retail outlets and not others, that you're able to articulate a reason for doing that. In our model ordinance, we have created 3 classes of food retailers: small retailers on the one hand, grocery stores on the other end of the spectrum, and then in the middle, what we call food retailers, which are of a size between small retailers and large grocery stores. And for each of these 3 classes of food retailers, you can have different requirements, and that's what we have in our model ordinance, different requirements for stocking of produce and staple foods in terms of amount for each of these 3 types of outlets. Again, this is something that you can tailor to the needs of your community, but it's important that you articulate the reasons for making any distinctions you'll be making. Finally, I mentioned earlier that licensing is efficient in one part because it is a perfect way to reach out and engage retailers during the licensing process. And the collaboration shouldn't stop there. I said that we tried to take the concepts from tobacco retailer licensing and other licensing for harmful products and really turn them into a more positive policy. And part of that is we have a lot of language in the model policy that requires education and outreach for retailers, such as conducting assessments, developing fact sheets, trainings, other outreach material, and compliance support in TA. Really, this is critically important, and we're going to have Alia talk about this in a moment based on their experience in Minneapolis. But really the goal here is we don't want to put retailers out of business through this. We would like to have requirements that are imposed through a license that make some sense, create healthier food retail environments, and that retailers can comply with. So the requirements need to be clear, and any help that you can provide, any collaboration you can have with retailers to help them understand those requirements and comply will be invaluable. And then finally, I do want to talk about implementation and enforcement, because implementation and enforcement for licensing is really one of the things that makes it very efficient, but it's not without work. You see listed here some of the considerations that you will have in deciding who's going to issue the licenses. How will you engage retailers and conduct inspections? How will you enforce penalties? Will you use an administrative procedure? Will you use the courts or something else? And then finally, what penalties? Now this implementation is really something that you have to consider carefully, and is going to require some legwork to determine in your community, well, who's already issuing licenses and collecting fees? And that might be the best agency to do that function. Who can conduct inspections? Well, maybe you have environmental health or code enforcement or some other agency already conducting inspections. They may have to be retrained on inspecting for the requirements of the ordinance, but maybe that's a good way for conducting inspections for this ordinance as well. And then with regard to penalties, what are the penalties going to be? We, as I said, don't want to make this punitive necessarily. What we want to do is increase healthy offerings. So the penalties in our model ordinance are designed to do just that, including a warning letter for first violations and some TA to help comply. But what penalties and how are you going to enforce them are more considerations. So really that's what our model ordinance does, and how, these are some of the key considerations if you're going to be enacting it. And before we turn to Alia for her experience in Minneapolis, I think Hannah wanted to respond to a few questions from the chat box.
Great. Thank you so much, Ian. We had a bunch of questions come in, and we don't have time to answer them all right now, but I have tried to group them. And Ian, I want to ask a few of you, and then I'll respond to a few. One of the questions that came in that I think we should talk about right off the bat is, what are the legal considerations? I mean, if a community enacted a policy like this, could they expect to be sued by either the food retailers or the food companies whose products were being regulated?
Well, that's an excellent question, Hannah. And I didn't talk about it during my presentation, but there are a number of legal considerations and several legal issues that we looked into when we were developing the ordinance. And it's hard to predict whether or not this kind of ordinance would get you sued, but it would not be surprising because it is a novel approach to healthy food retail. But that said, I think that if you have an attorney, and this is something that we could help provide some TA on, and also it's important to engage the attorneys in your city and county. If you have attorneys who can look into the state law in your state to determine that there are no legal barriers specific to your state, then we think this is a viable policy.
Great. So there were a couple of questions that came in about who created this ordinance and where has it been adopted, and I'll respond to that. Who created this ordinance? Public Health Law and Policy created this ordinance. We were really inspired by a very similar ordinance which has been, it's now in its 4th year in Minneapolis, Minnesota. That is, to our knowledge, the only municipality in the country that currently has attaches healthy requirements to their business permit. But we really hope that perhaps some of you on the call today will be inspired to experiment with this policy in your community. As Ian described, it is built on a very well-established strategy of tobacco retailer permits, and we're very confident that of our legal analysis that this is a legal strategy, but it is indeed a very novel strategy that hasn't yet been adopted. anywhere except for Minneapolis. Ian, could you speak? There are a couple of questions that came in about what the appropriate level of government. Is this policy just for the local level, or is there a role for state or county governments to use a business permitting strategy?
Well, if you start examining the permitting and license requirements for businesses in your state, you'll probably find that there are numerous licenses and permits required at all levels of government. This particular ordinance was crafted as a local policy, primarily to be used at the city or county level. But I don't know of any reason why it wouldn't be able to be implemented at a higher level of government, like a state level. I think we all are aware that there are different challenges with state-level policies, not only in the policy-making process, but sometimes with what happens to the policies during the policy-making process. So, I'm not sure what the policy would look like after it went through the sausage grinder at the state level, but this is primarily designed as a local policy. But again, I don't know why it couldn't be adopted at a higher level.
Great. Thank you, Ian. In the interest of time, let's move forward, and hopefully we'll have time for more questions at the end.
Okay. Well, great. As Hannah just mentioned, Minneapolis, Minnesota is the only place that we're aware of that has a licensing ordinance that has similar requirements for healthy food stocking. And I'd like to welcome Alia Ali, who's a project specialist with Minneapolis Healthy Living, which is an initiative aiming to reduce the burden of chronic illnesses in Minneapolis. And Alia has been with them for 4 years now. And she has also been intimately involved with the implementation of the healthy foods, or what we call the staple foods ordinance in Minnesota. Welcome, Alia. Thanks for joining us today.
Thank you, Ian, and I am very happy to talk with you all today.
Great. We're very happy to have you, Alia. Thanks very much for coming off your sick bed to join us today. Could you tell us a little bit about the Minneapolis Staple Foods Ordinance and what it requires and how it came to be adopted?
So the Minneapolis Staple Foods Ordinance is actually preceded my time at the city, or actually was passed right when I started there. But really, all those words that you see on the screen is really just saying that Minneapolis requires all stores with a grocery license to carry a minimum stock of staple foods, which includes a variety, 5 varieties of perishable produce items. And what's interesting about this ordinance is it wasn't about healthy foods, or the intention at first when city licensing first created it wasn't necessarily food access, even though from the health department standpoint, that's where our interest aligned with it. But it was really a crime prevention strategy, because city licensing were getting a lot of complaints around the corner stores and the perception that they're a haven for crime and drugs and any type of preconceived notion you have with corner stores. Those were the calls they were getting. So licensing came up with a package which required improved lighting, which required limited the number of, or the percentage of posters or signage they could put on their windows, and then also included the staple foods ordinance. And the idea was that the more staple foods that were in the store, the more people from the community would come. It would be less of a haven for crime, and it would serve as a community gathering place. So that's really what the impetus of the staple foods ordinance was. And then the health department signed on its support in terms of food access.
And can you tell me, so the language you had on the screen said that it applies to grocery stores. Does it cover, how many of the stores in Minneapolis are covered by these requirements?
So basically, our corner stores all hold a grocery license. So this staple foods ordinance would apply to them basically by the fact that they do have a grocery license. There is an exemption in there that I believe if the corner stores that have 300 square feet or less of kind of a food area, then they're exempt from this ordinance. But basically it applies to about 300 convenience stores, or the 300 convenience stores in Minneapolis.
Thanks, Alia. You mentioned that it really was brought about as a crime prevention strategy. And I'd like to talk a little bit about the enforcement and implementation of the ordinance, including the healthy food requirements. Which agency or who is responsible for enforcing these requirements on the ordinance?
This is our city licensing that is required to, or actually are the enforcers of it. They do go to each store about 3 times a year, and so it only made sense that they would be responsible for ensuring that compliance of the ordinance. I mean, they're the ones that have the teeth in terms of the city's regulatory codes when it comes to business licensing. So they're the ones that are able to administer violations and fines and really hold the stores accountable for complying with the ordinance.
Mm-hmm. Well then, can you also give us a sense about how enforcement has been going? How frequent are the inspections, and what is the rate of compliance? Have the inspectors noted anything, trends or anything particularly interesting during their inspections?
I can answer that in 2 different ways. So before we started our Healthy Corner Store program, we actually looked at our most vulnerable community, which is North Minneapolis, and the corner stores in there, and wanted to see if stores were actually complying with the ordinance. And when we went into the stores, I believe there was about 35 stores that we went into just to do visual assessment followed by an owner interview. And we found that most of the stores, about 70%, were not in compliance with the produce component of the Staple Foods Ordinance. And so when we talked with our licensing inspectors, like I mentioned, they go in about 3 times a year unless there is reason for them to go back or if there is a reinspection. And in having conversations with them, it sounds like there's probably about 50 violations a year with the Staple Foods Ordinance. And what would happen is that the stores would get a letter saying, hey, you're not in compliance with the Staple Foods Ordinance. Here's a pamphlet of what that is. And then they would get also a follow-up inspection. So it actually would, noncompliance with the Staple Foods Ordinance actually does trigger a reinspection. And then at that time, at the time of the reinspection, if they're not in compliance, then they do receive a $250 fine. And so the interesting piece of it is that our inspectors have told us, this is really such a hard policy to enforce because the expectation of or making stores carry fresh produce, I mean, it would be nice if we could provide them some additional support so they're successful in complying with the ordinance, because owners tell us, well, no one wants to buy the fresh produce, or no one wants to buy, and then you have residents that also tell us that we don't go to a corner store to buy fresh produce because the quality is bad, it's too expensive. So even though there is this ordinance in place, I mean, it just goes to say, and what we gleaned from all of this is that the supports need to be there to help the store owner be successful in this, and then also from the food access and healthy food standpoint of it, attract residents to the store to actually purchase the fresh produce.
Thanks, Alia. I think you answered a lot of my questions during that answer, and it's very interesting. The last thing I wanted to ask is if you had any sort of best practices or tips to share with the participants on the call who might be thinking about this licensing strategy.
Well, this licensing strategy is just a starting point. Just because a store has fresh produce, it doesn't mean that it's great quality. So I think that it just goes to show that, like I said before, that you do need to provide the support with the policy. If it's around procurement, if it's around handling support, if it's around, even labeling fresh produce, or even making sure that it's in front of the store. All of those things that we know, the traditional components of a corner store program, making that available to store owners, and then also thinking about the non-traditional partnerships. From a city entity, from a health department standpoint, working with licensing and working with zoning and working with all of the departments that are involved with the various regulations and codes that the city that are applied to certain stores is very crucial in terms of just the success of ensuring that the store owner is successful, and is avoiding violations, but also, like I said, from the food access point, making sure that because corner stores are cited as an access point and the whole idea of food deserts, that there is quality product in the store for residents.
Well, Alia, thank you very much. In the interest of time, I think we have to move on, but I want to say thank you very much for joining us and sharing some of your experiences today. And I've noticed that there are many questions that have come in specific to your ordinance in the chat box, and maybe I will
go ahead and start answering them right now.
Well, thank you very much, Alia. And so that leads to my last point, which is tailoring the model ordinance. And basically, many of these points have already been hit on. It's very important to know your state and local laws. We talked about that just briefly in response to a question, but not specifically. And we have some specific information to share to help get you started working with your attorneys to determine your own state law. And then you also have to consider what requirements should be included and what kind of incentives to provide as well. And what Alia was talking about a little bit as well, identifying and engaging your partners in the process, and really offering assistance and incentives to businesses so that they can comply with the new law. That's really our goal here, and that's something to take into account throughout the entire process. So with that, I now will turn it back to Hannah, who will move eastward to Buffalo, New York.
Great. Thanks, Ian. So I see a really lively debate happening in the chat box. I think that's really fantastic, and we really welcome that conversation to continue as we move east to Buffalo, New York. We're joined today by Jesse Gauk and Michael Ball, who are both employees of Buffalo Niagara Medical Campus and work with Buffalo Healthy Kids, Healthy Communities. Many of you may be familiar with this initiative. It's a Robert Wood Johnson Foundation funded initiative that works to implement a variety of healthy eating, active living, policy, and environmental change initiatives. And we're thrilled to have them on the call today. We've heard such great things about what's happening in Buffalo, so we're really pleased to have them on the call. Jesse Gauk is a project associate and project coordinator for Healthy Kids, Healthy Communities, and Michael is the project director. And I'm actually pleased to note that both of them are trained as planners, so we're thrilled to have them on the call today. So Jesse and Mike, could you take us through the steps that you've taken to understanding the food retail environment in Buffalo and how you've selected your priorities for changing the food retail environment?
Yeah. I'm going to talk specifically about what we have done here at the medical campus and through our Healthy Kids, Healthy Communities partnership, but just important to note that food work has been going on for quite some time in Buffalo, and in terms of where we got to with understanding the food retail environment, we really had a lot of help with initiatives that grew out of urban agriculture issues that came about. We had some existing resolutions passed at the city level around community gardening that really helped open the door to issues of food in the policy realm to be able to have that conversation, and that really allowed us to get to where we are. As a HKHC grantee, we did a food systems assessment for the city of Buffalo. So what we did is a series of policy briefs that looked at current conditions, the physical environment, national best practices, local policies and regulations, and then also stakeholder opinions on where the food environment was. And we were able to do that through partnerships with the local university and also local advocacy groups that helped us actually physically assess the environment. We had young people, high school students involved in going out and actually assessing the physical environment, looking at the corner stores, doing visual assessments, and bringing information back. And what we found was that our physical environment here in Buffalo is close to the pie chart that you showed at the beginning, 69.6, about 70% of our food retail landscape is restaurants in the city of Buffalo, and 11%, the second highest, is corner stores or convenience stores. In Buffalo, they're called deli stores. And so what we know also with that looking at farmers markets, grocery stores, and supermarkets all together only make up 6% of our food retail landscape. So from that assessment, we were able to determine that as a group of concerned partners throughout the community, which included the city and the county, that we needed to establish some goals around increasing opportunities for healthy food retail in the city, and that's where we are today.
Great, thank you. Could you talk about how you've engaged stakeholders in your work? We've been getting a lot of questions challenging how politically viable this an ordinance like this would be in today's economic climate, and that it might be burdensome for small retailers. I'm curious how you've engaged both the local elected officials and retailers in your work.
Great. So this is Mike, and I'll talk to that. I'll talk about the elected officials, and then we can go into the others. But really, the significance is having an organization like ours lead an initiative like this. It's related to the BNMC, our board representation. I'll talk about the medical campus as a trusted partner in the community and with elected officials, and our track record for success, the ability to integrate this kind of work into ongoing initiatives, and then just the actual time that we're able to spend with stakeholders and elected officials. So why in Buffalo some of this work has been successful and being led by the medical campus is because of our board makeup. So we've got, in addition to 9 different institutions that share a common geography down here, we also have representation from the mayor of the city, the county executive, and the president of the Common Council, so the city's main legislative body, all sit on our board of directors and are involved at that level. And in addition to that, we also have community representation on our board for the neighborhoods that surround the medical campus. So the board in and of itself has proven to be a good model and a good mechanism for getting these types of initiatives started and sustained within the community. And because of that board, we've been able to do all sorts of projects in the community. So from an elected official standpoint, our ability to take public dollars and actually implement the work has proven us to be a trusted partner, so that's helped us as well. And then integrating a lot of the work that we do, whether it's work with infrastructure or work in communications, we've got a lot of initiatives here. So sort of integrating health into what we already know is supported throughout the community has really helped. And then actually having Healthy Kids, Healthy Communities, an initiative funded specifically to do this work, gives us the ability to dedicate staff time to meeting with elected officials, their staff, and actually being out in the community. So that's a little bit about how I think an organization can really help lead an initiative like this. And then I'll hand it over to Jesse.
And I think specifically for your question about how we were able to build support from local elected officials, and I was watching in the comments box of people asking about the sort of political viability of this and the retailers as well. I think, we approached, initially our thought was to approach the local elected officials in terms of health and public health and community health and sort of appealing to, the need to keep the community healthy. And that really didn't work for us. So we changed our approach, and it has really evolved to talking to them about economic development opportunities, public safety, and something that Alia mentioned, the sort of community building. How do you turn food retail into opportunities for building communities between store owners, the communities that they serve, and then also the sort of political bodies. So the way we were able to do that, we worked with many great community partners to hold a food policy summit here in the city of Buffalo and invited many elected officials. We provided through that, we were able to bring in experts from around the country to have specific conversations around issues of food, talking specifically about opportunities for changes in policy and changes in the retail environment to actually start thinking about how the elected officials could move this to implementation and off just the discussion table. So that was something that we were able to do. And as that summit took place last fall, it's really been a catalyst for us. The conversations have skyrocketed in terms of their interest in getting involved at all levels of government. I think for the questions people asked about the different levels, we had representation of local, county, state, and federal government in the room for the policy summit. And what we found was that without us asking anyone to do so, the officials at the federal and state level then prompted their own conversations with our local officials and said, this is really something you should get behind. We'll figure out how we can help you with funding at different levels. So there was a lot of connections made through that summit that helped get things moving. In addition to that, through our grant funding, we have worked very hard to find opportunities to send local officials and their staff on different types of capacity building and professional development trips. So we send them to conferences, to summits, to workshops. We have sent our local planning staff to specific food conferences because we understood that they didn't have any expertise in-house. So we're really doing our best to shore up their expertise and their knowledge to help them build their internal capacity. And then in terms of working specifically with the retail businesses, we recognize that this is an area that we have a lot of room for growth. Specifically the convenience stores, we have worked on some levels to engage them. We know that we have gone out and talked with some store owners in some specific council districts, but there's difficulties there that we recognize as a part of this process we're going to have to go forward. There are language and cultural barriers both between the policymakers, the community, and the specific stores, that there's not a lot of organization into business associations, or it's very disjointed. The businesses change hands very, very often. The store owners change quickly. But we are in the process, and this is something that we're actually lucky to be working directly through the Common Council, our local legislative body. There are some councilmen that are leading the charge there that are starting to hold community meetings to engage local business owners in personal meetings and then community meetings to start the conversation around changing the retail landscape in corner stores.
Thank you so much. That's such a great overview. There have been a few questions that have come in for the two of you in the chat, and if you could respond to them directly. We're near the end, so I wanted to wrap up with just a few closing thoughts on, for those of you on the call, what can we learn from the stories from Minneapolis and Buffalo for how this ordinance might work in your community. And I think one of the threads that we heard is that in both of these places, advocates were already working very closely with the food retail environment. They had a good working knowledge of what was happening in the food retail environment and what the needs and opportunities were. Both Alia, Mike, and Jesse also described that they have been and are continuing to solicit input from really diverse stakeholders. This ordinance is not a one-size-fits-all, and the way that it's written allows communities a lot of flexibility to adapt it for what makes sense for your economic environment, your political environment, your food retail environment, your cultural environment. So there's really a lot of opportunity for adaptation there. And we had questions about how strong and how punitive the approach should be. A few folks responded that this felt like a punitive approach. So we really encourage folks to think about developing a policy that is strong and flexible, to consider how retailers comply with existing ordinances. If there's good compliance, that may make this kind of a policy a good match for your community. But we know that in some places the existing license requirements are really unevenly enforced. So that may mean that some work needs to be done around enforcement before diving into this policy. I've heard a lot of concerns and seen in the chat about concerns about cost. And depending on your state laws, you may be able to set the licensing fees to cover the regulatory costs associated with the licensing policy. That's what happened in Minneapolis. And you should check with your local attorney to see how fees are regulated in your state. But it is possible to develop this as a cost-neutral policy. And then finally, I think the idea of following through and continuing to provide support and incentives to the retailers as they implement is really critical. And the ordinance provides lots of ideas about funding streams to provide that additional support. And I'd also encourage folks to check out a resource from our website, Green for Greens, which is a really comprehensive list of local, state, and federal economic development incentives for healthy food retail. And then finally, I want to recognize that not all communities will be ready to adopt this ordinance, but there's still a lot of work that you can do to build the movement. Clearly, understanding what's going on in the food retail environment is critical. In some communities, you may wish to engage your elected officials using a healthy food retail resolution, and we're able to share examples of that if that's something that you would like. A resolution could be used, for example, to create a program to offer incentives to store owners, or to create a healthy food retailer's certification program, where PHLP is actually developing a model certification program that will be released later this year. So be sure to sign up for our announcement list to find out more about that. And then perhaps you might consider putting together a formal interagency task force to discuss the food retail environment. And for all of those ideas, PHLP is available to work with you. I wanted to just highlight a few of the resources that we've mentioned throughout the call. Getting to Grocery talks about a complementary strategy to what we've described today, which is attracting new food retail. The ordinance would apply to current food retailers as well, but you may have questions about new food retail, so I would refer you to that toolkit. Green for Greens, again, is available from our website, phlpnet.org, which is a tremendous compilation of public funding for healthy food retail. And again, I want to make sure that you know that PHLP is available to work with you implementing this ordinance or any of the healthy food retail strategies that we've touched on today. So thank everyone on the call so much for being with us today, and please do be in touch. Again, if you're interested in implementing the ordinance in your community, please let us know through the survey that will be sent out at the end of the webinar. Thank you so much.